Well, good morning and welcome to the Michigan Works Association 2020 Annual Conference. My name is Jeff Cassidy. I'm the Director of Policy with the Michigan Works Association. On behalf of the staff at the association and all of our sponsors, we thank you for being a part of the conference in this session titled How Mental Health Challenges Affect PATH Participants in Light of the COVID-19 Pandemic. A big thank you goes to Michigan Works Southeast for sponsoring today's workshop session. Our sponsors help make this conference happen, and we're very thankful for their support. Along with our sponsors, our exhibitors who have also given their time to be a part of our event. Be sure to visit the exhibitor booths during the designated exhibit hall times. Before we begin today's session, there's a few housekeeping items I'd like to share with you. Please make sure your audio is muted. And if you do have any questions or comments, please put them in the chat and I'll be sure to relay them to our presenter. Presentations will be available post-conference on the Michigan Works Association website. And we're eager for your feedback about the conference and this session. So please take a few minutes to complete a short survey. I'm going to put a link to the survey in the chat. And now I would like to introduce your speaker for this session, Rachell A. Williams, LMSW Program Director, Career Center with Development Centers. Please take it away.
Good morning, everyone. I want to begin by thanking you for your consideration in participating in this session, and I wouldn't be able to put this together without the help of my team here at the agency. I appreciate them as well. Before we begin this discussion, I would be remiss if I did not mention one person who has impacted my life as a leader and supported me in my efforts here at Development Centers these past 22 years. When I look back all those years ago and our partners would tell us, you will not or you cannot provide screenings or make referrals for treatment, her response was always, we will find a way. Because she believed in our clinical ability as an agency to provide emotional and psychological support to the hundreds of participants that we have seen, she was willing to take that risk so that we could get our Work First, JET, T60s, and PATH participants what they needed. This included attending countless meetings with FIA, DHS, DHHS, DWDD, and DESC, because we knew that upon referral, the participant was not ready yet to enter the workforce without therapeutic services. Over the years, she has spent countless hours, even listening to me cry at times, because we wanted to provide the customer in crisis with treatment so that they could be emotionally healthy at home and in the workplace. Not to sound religious, but I truly thank God for Dr. Kathy Leisman, who is now our CEO here at Development Centers, and she remains my boss. She has never changed and continues to allow me to soar as we endeavor to meet the needs of our participants. This session is entitled How Mental Health Challenges Affect PATH Participants in Light of the COVID-19 Pandemic. COVID-19 has affected, infected, and literally paralyzed not just us as individuals, but our communities and our nation. The physical and emotional trauma it has caused will leave us reeling for years because it attacked us as a nation without provocation. Emotionally, the impact of COVID has created in us an extreme fear beyond our comprehension. For some, we attempt to process its effect, and yet for others, it has immobilized us and left us choosing not to redefine normalcy. We've experienced anger, anxiety, panic attacks, and the greatest fear of all, the fear of loss of life. Unfortunately, many of our participants, especially in the Black and Brown communities here in Detroit, have suffered an even greater loss of life by COVID due to compromised immune systems. I don't have to tell you that of the approximately 200,000 people that have lost their lives to COVID, 1 out of 5 of those individuals have been Black or Brown. One commonality exists, unfortunately, for all families who suffered loss, and that was their inability to be there with their loved ones when they made their transition, resulting in their inability to grieve properly. For our PATH participants, and especially those living in Detroit, there has been no clarion call, even in the midst of this pandemic, where mental health or wellness support services have been extended. When it comes to our participants, our current mental health, educational, and workforce development systems, among others, are steeped in historical and structural racism. Congressman Levin also alluded to this in our general session on Tuesday. An example of this season of the unknown, we report on the travesty of COVID by shedding light on morbidity rates. But there has been no discussion with implementation of offering mental health services to those who have been most affected by this dreaded disease and living in highly COVID communities. As a nation, we praise first responders for sacrifices made and sacrifices that they continue to make, as we should. But to those essential workers, for example, in hospitals, our participants who leave their highly impacted COVID communities to scrub floors, keep restrooms clean, change linen in patients' rooms, the housekeepers that you were able to get employment for, dishwashers, transporters, dietitians, cafeteria workers, and even CNAs that we attempt to heavily recruit, who are exposed to COVID in healthcare settings just as first responders, but return to their COVID-ridden communities. After their shift, where is the acknowledgement? Where are the breakfasts, lunches, coupons, and parades for our participants? Have they too not sacrificed on a daily basis? Have they too not worked 12 and 14-hour shifts? Instead, we respond by providing aggregated statistics. We see them only as a statistic to report. Furthermore, unlike some first responders who can afford financially to quarantine or take advantage of funds made available by generous donors, the essential worker, our PATH participant, must return to their COVID communities. Unlike the first responder in this pandemic, should our essential worker request a quote unquote mental health day as a single parent, we all know they risk losing income for their children. As a nation, mental health services have openly been made available to first responders. And yet, as workforce development service providers, we've offered nothing to our participants. Not one policy has been reformed in this season offering mental health services to PATH participants. The injustice, continued expectation that the participant will toil without mental health supports until the work is done. It is my hope today that I will be able to provide something for your toolbox, as it were, which will compel all of us as workforce development service providers to change the narrative for the PATH participant as we weather this COVID season. I thought it important for you to be able not just to come to this presentation, but to participate in such a way that I would be able to provide something where you feel like, okay, I think I'm beginning to understand what she's talking about. I also think it important to give you a backdrop, which is why I spent as much time as I did with the introduction. What I would like to ask you is if you could write in the chat box for me if you are familiar with the iceberg model. It says here on the screen that the iceberg model is a systems thinking tool designed to help an individual or group discover the patterns of behavior supporting structures and mental models that underlie a particular event. Okay. Again, if you are familiar with the iceberg model, I'd be interested in knowing what your understanding of that model might be. Now, away from the definition, the iceberg model, yes, it is a systems thinking tool designed to help an individual or group discover the patterns of behavior. But what's important is that when we look at the model, the iceberg, what's seen from the outside is just a fraction of what exists underneath. So when we look at the three areas that make up the iceberg model, namely, one, patterns of behavior. Patterns of behavior means one's recurrent way of acting towards an object. Number two, when it comes to patterns of behavior, it's the supporting structure. What is the framework? How it was built or constructed to support the participant. And lastly, patterns of behavior means those mental models. How the mind represents real, remembered, hypothetical, and imaginary situations. Those structures are most important, and you'll be able to see that with them, they really do define our participant. So if I go back and I look at supporting structure, which is the framework, how it was built or constructed to support the participant. The mental model, how the mind represents real, remembered, hypothetical, and imaginary situations. Now, what I'd like to do is to discuss those 4 areas: real, remember, hypothetical, and imaginary. If I were to ask you to define for me what a family looks like, in order for there to be a family, there has to be a mother and a father in the home. So we know that that's the real. When it comes to many of our participants, if I were to ask them, when it came to a family for you, what is it that you remember? What our participant remembers, for the most part, is that there was no father in the home. The hypothesis then becomes, because a hypothesis is something that you have to prove. I remember that from graduate school. The hypothesis is, by my dad not being in the home, it had a negative impact on my life. So to prove that, those then become the behaviors that we see with our path participants. Are you following me? Okay. So then if we look at the imaginary for the participant would be, the question would become, what would it have been like if he had been there for me? Are you following me? So we have the real, we have the remember, we have the hypothetical, and we have the imaginary. Okay? All right. Any questions there so far? So let's look at the iceberg model. The iceberg, 10% is what you see. 90%. 90%, this is also what you get. 10% of an iceberg is what you see. 90% is also what you get. So if we look at the impact of COVID, because COVID is the most dominating factor in this presentation, we have to talk about the impact of it and how it affects every area on this screen. For participants that come through our program that I have been involved with over 22 years, every area on here, I'm sure, is not just what I see, but what you also see. We see individuals come to us who have experienced domestic violence, low self-esteem, addiction, trauma, no support system, frustration, anxiety, depression. Many have criminal backgrounds. They've experienced anger. They've been abused as children or even as adults, having experienced sexual abuse. Some come to us and even have suicidal thoughts. So now what we know about COVID is a disease, first of all, that just appeared. It came for us out of nowhere. So imagine for our participant if they're experiencing these kinds of behaviors, the impact of COVID becomes even more exacerbated for them. For those of us who have traveled, many of us have seen icebergs. What we don't realize is that we only see, quote, the tip of the iceberg. The tip of the iceberg, as I said, is the 10%. To express this to you in a way that you understand, the participant who stands in front of you, whom you've readied for employment, is all that you see. You see an individual who's dressed correctly. You've spoken to them about their attitude. In Detroit, we have a program called Jackets for Jobs. We've sent them there so that they can receive proper clothing. Your career coaches have talked with them. Your job developers have sat down with them and instructed them on what to say. So you have a package that looks prepared. Another example of this, for those of us who celebrate holiday during Christmas time, you go to Macy's or you go to Nordstrom's. When you walk in, they have these beautiful bottles of fragrance. That's what you see. However, when it comes to the iceberg, the 90%, which you don't see and is connected to the 10%, as I said, is also what you get. That which lies beneath is the true definition of the participant that stands in front of you. That individual that you see has everything to do with the framework. What was that framework built upon? We know for many of our participants that that structure is very fragile. That which lies beneath is the true definition. So when we look at the impact of COVID on PATH participants through the lens of the iceberg, every mental health challenge becomes magnified. It becomes exacerbated. If we look, for example, at domestic violence pre-COVID, our participant would find refuge, perhaps at a shelter, at a friend's home, or a family member's home. COVID impacted our participant, then has no place to go, as people are unwilling to allow her and her children to reside for fear that death may result. So she remains with her abuser. Why? Because she has no place to go. Mind you, these are also your essential workers that you send to hospitals, that you send to facilities so that they can obtain employment. At that point, they are working. The presence of COVID has also presented a new challenge for many of our participants, and that with the presence of agoraphobia. I must apologize because when I submitted my slides, I left the most important traumatizing event for not just our participants, but for everyone, and that is the word agoraphobia. Agoraphobia, and you can add this when should you choose to get a copy of this presentation. On this slide, add the word agoraphobia. Agoraphobia is when an individual has a fear of leaving their dwelling. The intensity of this fear, not only is it gripping and compelling, but it creates an immobilization for an individual where they are so frightened of leaving their home that it affects their thought process in such a way that they cannot move. It becomes terrorizing for them. So if we can imagine what this is like for those of us working remote, and in some cases struggle with agoraphobia as well, the difference for us, we have supports. For example, we can obtain online support groups here at our agency at development centers, because we are a behavioral health agency. Immediately when we learned of COVID, we put support groups in place for our staff. However, imagine what it's like for the PATH participant who has none. Imagine what it's like for the PATH participant who is forced to go to work, not having had anyone to talk to about what their experience is like. Imagine them going and working in a hospital that's COVID ridden. And we all know every hospital, not just here in Detroit, but across the country, had been overwhelmed with individuals who were COVID. Imagine what it's like for them. Imagine what it's like for them when everyone in their community, including family members, are possibly exposed. Imagine what it's like for our participants who have experienced multiple deaths of family members with the same zip code due to compromised immune systems. Imagine for a moment, if you will, what it has been like for them. Development Centers, as I said, is a behavioral health agency. We are fortunate that when people come through our doors in our PATH program, and if it appears that they have mental health challenges or share those challenges with us, we are able to screen and have them immediately seen by a therapist. If they need to see a psychologist or a psychiatrist, we have staff located here at our agency. The other thing that we have been able to do is we actually have slots within our agency. So if we have someone who decompensates, we can have them seen immediately. Because at the end of the day, going back to what I said, we want to walk into Macy's and we see that perfume bottle, and we want that perfume bottle because we know that when we spray it, it's going to give us the fragrance that we desire. The same holds true for the participant. When you look at that participant, you don't want to look at the 10% only. You want to know that you have addressed the needs of the 90% that lies beneath. What I can tell you is that the participants that we have seen, that there are 3 classifications of severity for people who have mental health challenges. Diagnoses range from mild to moderate to severe. From the hundreds of participants that I've screened and referred for treatment, those individuals, we were able to provide services for them. So what I'd like to say to you is that in order for you to be able to get the services that that participant needs, we need to be able to find out exactly where that individual is so that we're presenting the kind of person who not only will get that job, but will be able to keep it, to retain it. It's important that we know as much as we possibly can about the individual. I had shared with you about mild, moderate, and severe diagnoses. When it comes to the PATH participant, examples for the COVID impacted PATH participant with mild to moderate symptoms, as seen on this iceberg, would be domestic violence, low self-esteem, anxiety, depression, and agoraphobia. Okay? Now, what I'd like to do at this point is to show you the severity of communities in Detroit that have been impacted. And those communities are here where I work. On July 7th, the Detroit Free Press reported on the number of coronavirus cases in Detroit by zip code. At that time, because we know the numbers change daily, what they found in Detroit was that the highest impacted areas for COVID were in Northwest Detroit, as I said, which also happens to be where I work. For example, our agency is located in zip code 48219, and it's in the top left-hand corner of the screen. What you see there for 48219 in July was that there were 922 cases of COVID. Our PATH participants also come from zip codes 48221, which is also a zip code that we serve. That zip code had 522 cases at the time of reporting. We also serve 48223, which had 372 cases of COVID. My attempt with this slide was to show you that the participants, the PATH participants that we assist in becoming employed, this is what COVID looks like and that they experience on a daily basis. What we have to do, the areas that you come from, perhaps your areas are not impacted the way that they are here in Detroit. What we have to do is to be able to support our participants in ways that we would not only support ourselves, but advocate as well for our families. If we just look at statistics alone in these zip codes, you're talking a couple thousand of people who have contracted coronavirus. We don't know the trajectory of what it's going to look like when fall comes in its full season. But what we do know by looking at these cases is that we need to be able to provide the participant with as much emotional support as we possibly can. When participants refuse to go to work because they're concerned about whether or not they're going to contract the disease, some of us may feel like, well, you know, we give them bus tickets, we'll transport you, we'll come and take you to work. That's not the reality. The reality is they have the exact same concern that you do about contracting the disease. What I'd like to say to you is, as a stakeholder, what's preventing you in this COVID season from making a difference in the life of your participant? I see you on the top. And as I said, you are the 10%. Your face is what we see. But what really lies underneath? I'd like to ask you, if you could, in the chat box, just put one word in there that you feel is preventing you from making a difference. If you can put one word in that box.
Overwhelmed.
Okay.
Compassion fatigue.
Fatigue.
Compassion fatigue. Nothing. Technology. Oppression. Apprehension. Disconnection. Exhaustion. WPR. No shows. Uncertainty. Anxiety. Fear. Contracting disease. Stress. Resources. Unbalance in all aspects of life. OMG.
Wow.
Concern.
Wow. That's good.
Okay.
Oh my goodness. Gee, I feel like I should have you come to my office today, right? With some of the examples that many of you have given. It's actually very concerning to me, some of your examples. Some of the things that you wrote were stress, being overwhelmed, fatigued. I'm assuming no technological support, apprehensive, you feel disconnected, you're exhausted, you're concerned about your numbers, the WPR, you're concerned about the no-shows, living with uncertainty. Some of you mentioned anxiety, and the other is fear. So when it comes to areas that you have mentioned, it's important for us to understand that the feelings that you have are the same feelings that the participant has. So, so what I would say to you, we all know that in order for us to help other people, we need to be healthy ourselves in terms of wellness. And so the first thing that I would say to you, and had not even thought about this because I didn't know that I would get these kind of responses to the extent that I have, but thought that some of it might be present. But when I'm looking at these, the first thing that I would say to you is, what are you doing for yourself? How are you taking care of you? That's the first thing. Secondly, what I would say is that when you find that there is a commonality between you and someone else, ask yourself, what would I do for me in this kind of situation? And if you know that what you would do for you, perhaps you might exercise, perhaps some of you even, and I'm just going to go this far and say it, some of you who are experiencing agoraphobia, you have to be able to perhaps come out of your home, your apartment, go walk to the corner, come back home. 2 days later, instead of walking to the corner, walk to the second corner, come back home. Those are the kind of supports right now until you can get support from your agency that you do for yourself and share those things with your participant. You cannot be afraid. The person who wrote fear, I'm assuming that, well, before I make that assumption, the person who wrote fear, can you give me an explanation in that chat box of what you were speaking of? I don't want to make the assumption that you yourself are fearful due to the impact of COVID. I would like to understand whether or not you're speaking of the participant.
Nothing yet. But somebody put things.
Okay. Okay. Well, no one responded, but what I want to do, I want to make sure, I'm not sure if in the information that my email address is on a slide. But I want you to take down my email here at work. Yeah, could you put it in the chat? Okay. Someone's going to put it in the chat for you, and you could put our number here too. My email and phone number is going to be here. So in the event that you're thinking about what you can do to assist the participant and you'd like to speak with me about it, I'd be more than happy, more than willing to assist you in that way. Someone wrote, we need to recognize how institutional racism underlies these concerns. And excuse me, I had mentioned earlier about systemic racism, simply because when it comes to participants, we believe that because we are providing them with economic support, medical support, food assistance, those kinds of things, that we're meeting their need. But if we don't meet people's needs holistically, that means everything that they bring is who they are. That's that 90% on top of the 10%. If we don't meet those needs holistically, we are doing people a disservice. And so I want to say to you that we've got to advocate. You have to recognize that you are your participants' hope. Find out what they need. Find out whether or not it's something that you are able to attain with the support of your manager. Someone mentioned resources. I'm assuming you're talking about lack of resources. But let me say to you that when it comes to resources, you can be very, very creative. And I'd be willing to talk with you about resources perhaps that you don't even know is available in your community. So get in touch with me about that, and I'd be glad to speak with you. I specifically want to say to the individual who wrote WPR, our work participation rate, what you have to also understand is that, yes, those numbers are important, But because of COVID, if those individuals are not able to stay on their job, now you have an additional problem that needs to be addressed. So all of these things are important. I want you to know that you are stronger than you think you are in this season, and that you're more than able and capable of giving those individuals the support that's due them, not option, that's due them. You just have to find a way to make the investment. Okay? Any questions for me? Someone asked, how do you suggest screening our PATH participants? Let me begin by saying this. When it comes to mental health, immediately there's this frenzy like, oh my God, I'm not trained for that. I'm not educated for that. I might say the wrong thing. The important thing, I want to say this to you because I had to train my staff on how to ask questions. The only thing that you need to do when that participant comes to you and says, I'll give you an example. We had a participant once who came to us and said, I'm falling apart. I'm depressed. I can't take it. She immediately decompensated. We had to have her seen. We had to have her on meds. Today she's working. The only thing that you have to do is to find out what's going on with the participant, take that information, lay it at the feet of your manager, let your manager know, unless we intervene, I'm concerned about putting this individual in employment. One of the things that I have learned over the years is that in the event something happens with a participant and there's some kind of investigation, what's going to happen? The question always is, who was the last person that they spoke with? You want to be able to say that myself and our agency did everything possible to advocate for the participant, especially in this season of COVID. If you yourself are experiencing the things that you outlined for me, you need to take those feelings, leave them at the feet of your manager, and say, we need to have a conversation. I'm struggling. I'm having some issues. I'm uncertain about things. I'm anxious about things. I'm fearful, stressed, overwhelmed, fatigued, all of the things that you wrote. You need to have a one-on-one conversation with your manager. Unhealthy people cannot make other people healthy. Remember that. Okay? Any other questions? Thank you so much for your
There was one more question in the chat. How would you suggest opening the conversation with our location to encourage mental health resources on site?
What I would suggest that you do is with your colleagues, say for instance, there are 7 of you. I want you to go to, I believe it was the second slide where I outlined for you the iceberg, and it had all of the mental health challenges. You see there where it was low self-esteem. How do I do it? Let me go back. Excuse me 1 second. Okay, let me go back here. Okay, right here, this slide. I want you to sit down with your colleagues, spend an hour, talk about, have we ever seen anybody come through our agency that experienced domestic violence, addictions, any of these areas? Then I want you to go back through all of the participants on your caseload. Then once you all have compiled a number and you've identified the areas that you've seen, take that to your manager. Let your manager know we need to have someone in here to help our participants. The other way that bears this out is when you're looking at your work participation rate, there would have been a fall off somewhere with some of these participants because they weren't able to retain their job. So that's the way that I would handle that.
That's a great comment. Thank you very much.
Mhm.
This ends our presentation today. I'd like to thank our presenter. We appreciate everyone's time. I hope you've had some great takeaways and will enjoy all the features of the conference. The exhibitor networking break is next, so take time after this session to video chat with exhibitors or watch their informational video, or go to the networking tab to be randomly paired with another attendee for 2 minutes to meet new people. So thanks very much, everybody. I hope you enjoy your day.
Thank you.